Hello, in this video we will go over how to perform self-massage to the throat, when this treatment is appropriate, and describe the medical physiology of the therapy. My name is Matt Morrissey. As a retired physical therapist who specialized in joints like shoulders, knees, and hips, I found myself as a patient after throat surgery. Through the process, I was eager to learn more about massage and for a guide on how to perform the procedure myself. But the available resources were slim and unhelpful. So I decided to create this video for others that may see themselves in a similar situation. So here we go. This video is for individuals who have had surgery and/or radiation in their throat area. The purpose of this video is to help educate you on how to perform self-massage to the throat to limit the effects your cancer treatment might have had on your throat soft tissues. The particular effects we are trying to combat are lymphedema and fibrosis, which may lead to increased swelling, difficulty swallowing, limited range of motion, and pain or muscle spasms. The methods used for self-massage are divided into two groups. 1, manual lymph drainage, and 2, throat fibrosis. We will cover basic techniques for performing manual lymphatic drainage, or MLD, for your head and neck. These techniques are useful for decreasing swelling in your face, under your jaw, and in your neck, particularly if you've had cancer surgery or radiation which affected the lymph nodes or vessels in this area. But wait, there are a few precautions to be aware of. Number 1, if you're receiving chemotherapy, you should not perform MLD over the side of your neck with a portacath. 2, if you are currently in radiation therapy or less than 6 weeks out from radiation therapy, you should not perform MLD over skin that is red or tender from radiation, as it is unwise to irritate your skin with massage. And 3, also, do not perform these techniques if you have an untreated infection, if you have a blood clot or DVT, or if you have compromised heart or kidney function. Ideally, you will start self-massage under the supervision of your physical therapist. Your physical therapist may also recommend a specific sequence or modification of these strokes based on your diagnosis or condition. Always try to consult with a certified lymphedema therapist prior to performing MLD on yourself. The lymphatic system works together with the arteries and veins in your circulatory system. It functions to remove large proteins, waste products, and fluid from the tissue spaces. The fluid and waste products move through lymphatic vessels to lymph nodes, where the fluid is filtered to remove any bacteria or impurities. The clean fluid then travels through larger lymph vessels back into the vein that returns blood to the heart. So any damage to those lymph vessels or nodes can create a bottleneck that causes fluid to back up into the tissue. With MLD, we stimulate affected and unaffected lymph nodes to help to route the fluid to alleviate that bottleneck. These techniques should never be painful, and people usually feel more relaxed and comfortable following MLD. The basic stroke involves using just enough pressure from your hand to stretch the skin without sliding over it. We start with stimulating lymph nodes first and then route fluid to those lymph node clusters. This increases the rate at which your body can drain fluid from the tissues. Start by stretching the skin in each armpit up and in towards your chest using the flat of your hand. You can cross your arms in order to do both sides at once. Now move your hands to the sides of your neck, just above your collarbone, and stretch the skin down and in toward the notch in the front of your neck. Next, stroke gently from collarbone to armpit. This helps move fluid away from the neck toward the lymph node cluster in the armpit. Now, stroke gently down from your hairline to the base of your neck. Remember to use the flat of your hand and only enough pressure to stretch the skin. Do the same thing on the front of your neck, moving from the angle of your jaw down toward your collarbone. You may find that you need to swallow frequently as you're doing this stroke. Now, place the pads of 2 fingers under the center of your chin. Stretch the skin toward the angle of your jaw beneath your ear. Move your fingers along your jawline, performing the stretch in each position until your fingers are just beneath your ear. Repeat this 5 to 10 times on each side of your jaw. Make Spock fingers. Place your pinky and ring fingers in front of your ears and your index and middle fingers behind your ears. Gently stretch the skin down and back 5 to 10 times. If you don't have any facial swelling, stop here and follow up with repeat strokes above your collarbone and under your arms. If you do have facial swelling, stroke down the side of your face with 1 or 2 fingers from the side of your nose to just under your jawbone, and from under your bottom lip to under your chin. Then follow up with repeat strokes above your collarbone and under your arms. Manual lymph drainage is most effective if performed 1 to 2 times a day, especially if you can do it prior to putting on a compression garment. It generally takes some experimentation to figure out the frequency that's most effective for you. If your edema is mild, you may be able to perform it less frequently. If you have a flare-up, it can be helpful to do it more often. Fibrosis is excessive or thickened tissue deposition which is characterized by hardening of tissue inside the body or on the skin. Fibrosis can result from surgery where specific tissue thickening occurs, also known as scarring. And fibrosis can occur more generally from radiation. Fibrosis from surgery can occur relatively quickly after the surgery, while fibrosis from radiation is a longer process, occurring over months. For fibrosis after surgery, we recommend that you receive early instruction from a physical therapist and self-massage of the surgical scar area. Additionally, a therapist can help you identify specific issues that are tight in your throat. Generally, you should use more force in this type of massage as compared to MLD. Let's use my own case as an example. Here we go. My scar runs along the left side of my neck. I use the middle and index fingers of my opposite hand to massage the area in a circular fashion. I also have tissues that are tight near the angle of my jaw to the outside and just below my chin on both sides. For the jaw area stiffness, I use my thumb on that side to not only perform small strokes in the area, but also to compress and therefore stretch the tissue. As for the tissues below my chin, I massage both sides with my thumbs like this. Although not necessary, I like to do this while lying on my back. Another stroke I apply below my chin is this one, where I use the web between my index finger and thumb to stroke down from the chin. The final method I use to maintain throat tissue mobility is this, where I compress the throat in 2 spots at the same time with my thumb just below the chin and the middle and index fingers in my opposite hand to the outside of the big muscle that attaches to the collarbone. Generally, I try to apply compression for 30 seconds while strokes are done in sets of 10. In total, my present program takes about a half hour, and I do this every morning before getting out of bed. I think a half hour a day should be the minimum you do. As for what you should feel as you do this massage, first, let me say that it should not be painful. Discomfort is okay, but pain is not. The discomfort you feel should be no more than the sort of discomfort you feel when stretching a muscle, like the hamstrings. And the discomfort should not last beyond the period of your self-massage. Ideally, your therapist would guide you through your early use of this program to ensure you're doing the techniques correctly and at the best intensity level. I hope you found this video helpful. For more information about MLD and the throat-related issues we discussed here, check out these links. They are also available in the video description. I want to thank Jess, a physical therapist from Providence Health, for helping me with this video. I also want to thank Dr. Peter Belaski for providing medical guidance. And I wouldn't have been able to produce this video without the resources and incredible talent from my local nonprofit media center, Open Signal, Portland Community Media. Thank you for taking the time to watch this video.